The musculature of the thigh can be split into three sections: anterior, medial, and posterior. The quadriceps femoris consists of 4 individual muscles: 3 vastus muscles and the rectus femoris. They form the main bulk of the thigh and collectively are one of the most powerful muscles in the body. The muscles that form quadriceps femoris unite proximal to the knee and distally attached to the patella via the patellar tendon. Rectus femoris is the only one of the quadriceps femoris muscles that crosses the hip joint. It originates from the ilium, just superior to the acetabulum. It runs straight down the leg and attaches to the patella by the quadriceps femoris tendon. Vastus lateralis originates from the greater trochanter and the lateral lip of the linea aspera. Vastus intermedius is deep to rectus femoris. It originates from the anterior and lateral surfaces of the femoral shaft. Vastus medialis originates from the intertrochanteric line and medial lip of the linea aspera. Together with rectus femoris, they come down onto the quadriceps tendon, meeting at the patella and then inserting onto the tibial tuberosity by the patellar tendon. The muscles in the posterior compartment of the thigh are collectively known as the hamstrings. They consist of the biceps femoris, semitendinosus, and semimembranosus, which form prominent tendons medially and laterally at the back of the knee. Like the biceps brachii in the arm, the biceps femoris muscle has 2 heads, a long head and a short head. It is the most lateral of the muscles in the posterior thigh. The common tendon of the 2 heads can be felt laterally at the posterior knee. The long head originates from the ischial tuberosity of the pelvis, and the short head originates from the linea aspera on the posterior surface of the femur. Together, the heads form a tendon, which inserts onto the head of the fibula. Semitendinosus is a largely tendinous muscle. It lies medial to the biceps femoris and covers the majority of the semimembranosus, on top of tendinosus, T for top, T for tendinosus. It originates from the ischial tuberosity of the pelvis and attaches to the medial surface of the tibia. The semimembranosus muscle is flattened and broad. It is located underneath the semitendinosus. It originates from the ischial tuberosity, but does so more superiorly than the semitendinosus and biceps femoris. It attaches to the medial tibial condyle. This is the anterior aspect of the leg. Here we have the tibia for orientation. In the anterior compartment of the leg, we are looking at tibialis anterior and extensor digitorum longus. The tibialis anterior muscle is located alongside the lateral surface of the tibia. It originates from the lateral surface of the tibia and attaches to the medial cuneiform and the base of metatarsal 1. Extensor digitorum longus lies lateral and deep to the tibialis anterior. The tendons of the extensor digitorum longus can be palpated on the dorsal surface of the foot. It originates from the lateral condyle of the tibia and the medial surface of the fibula. The fibers converge into a tendon which travels to the dorsal surface of the foot. The tendon splits into 4, each inserting onto a toe. Fibularis, or peroneus longus, is located in the lateral compartment of the leg. Fibularis longus is the larger and more superficial muscle within this compartment. Fibularis longus originates from the superior and lateral surface of the fibula and the lateral tibial condyle. The fibers converge into a tendon which descends into the foot, posterior to the lateral malleolus. The tendon crosses under the foot and attaches to the bones on the medial side. namely the medial cuneiform and the base of metatarsal 1. The posterior leg is the largest of the three compartments. The superficial muscles form the characteristic calf shape of the posterior leg. They all insert into the calcaneus of the foot via the calcaneal tendon, more commonly termed Achilles tendon. The gastrocnemius is the most superficial of all the muscles in the posterior leg. It has two heads, medial and lateral, which converge to form a muscle belly. The lateral head originates from the lateral femoral condyle and the medial from the medial condyle. The fibers converge. In the lower part of the leg, the muscle belly combines with the soleus to form the Achilles tendon, which inserts onto the calcaneus. The soleus is located deep to the gastrocnemius. It is large and flat. Named soleus due to its resemblance of a sole, a flat fish. It originates from the soleal line of the tibia and proximal fibula area. The muscle narrows in the lower part of the leg and joins the Achilles tendon, as does the gastrocnemius. If we remove gastrocnemius and soleus, we can now see the tibialis posterior muscle. It's the deepest of the posterior compartment muscles. It originates from the interosseous membrane between the tibia and fibula and posterior surface of these two bones. The tendon enters the foot posterior to the medial malleolus and attaches to the plantar surfaces of the medial tarsal bones. Flexor digitorum longus, surprisingly, is a smaller muscle. It is located medially in the posterior leg. It originates from the medial surface of the tibia and attaches to the plantar surfaces of the lateral 4 digits.